It was on the 29th of November, and a busy day at the Abiy Adi General Hospital, 85 kilometers away from the capital, Mekelle. Our reporters traveled to central Tigray to assess the current living conditions of residents since the signing of a peace agreement between the Tigrayan and Ethiopian governments. But what they witnessed was the tragic death of a young mother. Letta Mikael was a pregnant mother of 2 from the district of Qayih Takhli. Like many mothers in Tigray, she had been unable to get proper pregnancy checkups as health facilities in her area had been destroyed by the war. As a result, Letta Mikael was forced to give birth at her house with the help of her relatives. Having no one with a medical background present in the room, Letta Mikael's baby died immediately, and she was forced to seek medical attention elsewhere. Brhane Gabra Medhin, Letta Mikael's brother-in-law, remembers the moment as follows.
ليتي ساعة 7 يا وليدة كاو مس ولدت مدمي تقاطموا.
She got into labor and she gave birth at around 1 a.m. after midnight. Her child died and she started bleeding non-stop. After that, at around 3 a.m., we started our journey to the hospital.
As no ambulances were spared from the war on Tigray and no vehicles were moving due to lack of fuel, her family traveled for 15 kilometers carrying Letta Mikael on a stretcher for nearly 4 hours to a nearby hospital, the Abiy Adi General Hospital.
ساعة 9 كاو غزا تلعلنا كاوم منقدي رحق سلالخنا قعزو.
We started the journey to a hospital nearby at around 3 a.m. But the journey was so long, and since there is no ambulance or any other transportation, we arrived at the hospital at 7 a.m. in the morning.
Things didn't get better for Letta Mikael and her family even after they reached the hospital. The only difference between her house and this place was that there were people wearing white gowns, doctors and nurses running everywhere, but unable to help due to lack of materials and medicines. Letta Mikael finally lost the fight and died at the hospital, surrounded by medical professionals.
We are in a really bad situation. We are in a really bad condition.
If there had been an ambulance, we could have saved her life. The delay caused by lack of ambulance in transportation had a huge impact. Unfortunately, she died in our hand without receiving any kind of help. It's really sad.
Letta Mikael gave birth to both of her children at this very hospital years ago. Brhane says if it wasn't for the siege-induced lack of transportation and medical supplies, Letta Mikael could still have been alive.
She gave birth just fine the first time. She gave birth at this hospital. Mothers used to give birth at health centers or hospitals before the war. If there were enough medical supplies, if the world hadn't overlooked us, she could still have been alive. But because medical supplies still remain scarce, mothers are dying on a daily basis.
Medical director of Abiy Adi General Hospital, Haddush Haile, says that the hospital had lost many infants in the past months and says that Tigray needs an unfettered access to medical supplies based on the peace agreement signed.
We're losing many infants on a daily basis. When the peace agreement was signed a month ago, we hoped we could get back to our normal lives and give an adequate service like we used to. But nothing is changed on the ground. We're still losing patients on a daily basis. The international community needs to pressurize the Ethiopian government to meet the agreement signed on its end and allow unfettered access to medical supplies.
Abiy Adi General Hospital had a capacity to serve more than 120,000 people. People from neighboring Ago were also served here before the war was waged on Tigray. Now, the deaths of children and mothers due to the collapse of health system in Tigray remains a matter of statistics as the world keeps watching with no concrete measures up until this day.